Welcome to our brief presentation and educational information for your safety during this COVID-19 pandemic. First and foremost, proper hand hygiene and/or sanitation is your first and last line of protection. The coronavirus is spread through droplets caused by coughing, sneezing, or direct contact with someone infected or their contaminated possessions. Remember, as long as you have not come in direct contact with a potentially infected person or their contaminated possessions, you are safe. The big question is, how do I know if someone is infected? The answer is easy. Everyone and everything is infected or contaminated. If you keep that in mind, you have prepared yourself psychologically, and now all you need to know about is proper PPE equipment required and its use. PPE stands for Personal Protective Equipment. This equipment includes hand sanitizer, surgical procedure masks, disposable gloves, and sanitizing wipes. Hand sanitizer. It is used at the start of every delivery, after coming into contact with parcels or packages, after dropping off parcels and packages, or any time you cough or sneeze. It is important to understand that hand washing whenever possible is the best defense. However, when you are unable to, hand sanitizing is accepted to kill viruses and bacteria. Surgical masks. Surgical masks are great for providing a barrier by reducing water droplets spread and water droplets inhaled. We prefer the double isolation method, which simply means the driver wears a mask and so does the client. It is important to remember that the client must place the mask on themselves following the driver's instructions, and that the driver is not to place the mask for the client. We will show this process later on in the video. Your personal mask can be reused provided they do not become moist. Disposable gloves. Disposable gloves are single-use and then disposed of. Gloves should be used prior to the cleaning process, which uses sanitizing wipes, and once the cleaning process is completed, you remove the gloves, sanitize or wash your hands with soap and water. Remember that once gloves have come in contact with any contaminated surface, packages, or person, then anything the gloves come in contact with are also now contaminated. The continuous use of contaminated gloves is the second leading cause to disease transmission. Sanitizing wipes. Sanitizing wipes are said to kill over 99% of bacteria and viruses, including COVID-19. With gloved hands, wipe all potential surfaces that our clients or other persons may have come in contact with, which includes any parcels, packages, or belongings, as well as anything they may have had contact with in the vehicle. This may include, but is not limited to, door handles, seat belts, cup holders, etc. All of the above contaminated PPE and equipment are not considered biohazard waste, and as such can be disposed of in any appropriate refuse container or garbage bag. In the next part of this video, we will discuss PPE best practices. Hand sanitizing. Hand washing or sanitizing along with not touching your face is the best method of reducing your chances of contamination. These are the regions that are most often neglected. Therefore, we will show you the proper process of hand sanitization. Use a generous amount to wet the entire surface of the hands, fingers, and wrists. Be sure to cover the backs of the hands, between the fingers, the thumb all the way around, and fingernails. Continue rubbing 20 seconds or until hands are dry. Glove use and removal. Gloves are to perform one task and then meant to be discarded. They are not meant for all-day use. Most commonly, you will use them for cleaning. Next, we will show you how to don and doff gloves. Slide hands into proper size glove to ensure proper fit. To remove the glove, grab the inside of one glove palm and slide it over your hand. Then, with your ungloved index finger, slide under the cuff of the other glove and roll it over your hand and discard. Always perform hand washing or sanitizing after removing gloves. As we discussed earlier, sanitizing or wiping down is vital when it comes to infection control. We will examine that process now. Before beginning the process, don a clean pair of gloves. Grab a fresh wipe from the container. One wipe is good for one surface. More wipes may be needed for multiple surfaces. Rub the entire surface, making sure to make a few passes. Discard the wipe or ball it up in your hand if you are prepared to take your gloves off. Remove your gloves using the proper process and discard. Again, hand washing or sanitation afterwards. In the last part of this video, we will show you the proper way to don and doff a surgical mask. Due to supply and demand, we have shown the process for both types of masks. Remember that you are not to place the mask on a client, but to explain to them how it's done. The first mask that we will look at is the tie mask. Tie the top part of the mask around the back of the head. Then tie the bottom part. Stretch the mask over the face and then secure the nose. To remove the mask, simply follow the process in reverse. Once the mask is removed, it may be discarded and perform hand sanitization. The other mask is placed directly behind the ears, stretched out, and secured over the nose. To remove, simply slide the elastic bands over your ears and discard. Sanitize your hands afterwards. Although it's common practice to reuse a mask, it's important to only touch the straps or elastic bands to avoid contaminating your hands. Store the mask face down on a piece of paper or paper towel. If you have any questions or concerns, please feel free to contact your respective manager or coordinator. Please visit www.gnb.ca for the latest updates on COVID-19 and how to stay protected.